Okay, so it looks like we are going live. Let me make sure that we're live in the group here. And we are. Okay. Welcome everyone to our weekly live training. If you are new to the Mom and Baby Nutrition Support Group, my name is Alex Gardner, and I am a registered and licensed dietitian. And my goal in life is to help moms just like you nourish their bodies so they can deliver a happy, healthy baby, have more energy, and breastfeed successfully. And of course, I work with prenatal, postnatal moms, and their little ones. So today we're actually going to dive into a topic that I get a lot of questions on, and that is nausea and morning sickness during pregnancy and how to help control that or kind of alleviate some of the symptoms. And sometimes, unfortunately, moms, it's just so bad that they end up taking prescription medication. And that's okay because there are pregnancy safe prescription medications for nausea. You just need to ask your doctor about that. But typically the first line is to go through some of these tips, and that's what we're going to do today. Now, normally I have not done a live training with slides before, so we're going to ramp up our live trainings, and I'm going to include slides in today's training. And if you're watching live and you have any questions, or even if you're watching the replay and you have a question, please feel free to put them in the comments. I'm going to be watching the comments to see if anybody has any questions. And if you stay to the end, I actually have a very special giveaway for some morning sickness tea and morning sickness shoes. So you're not going to want to miss that. It's a free giveaway and it'll be shipped directly to your house. So let's go ahead and get into nausea and morning sickness. So nausea and morning sickness is very, very common in pregnancy. Almost every mom has morning sickness in the first trimester, and it usually goes away after the first trimester. For some moms, unfortunately, it doesn't go away after the first trimester. And of course, some women even get sick, just like car sick, motion sick, any of that. So this is really great tips for anybody that might be suffering from nausea. So there are a few tips that we can talk about. It might or it might not work for you. So what I recommend that moms do is they try a couple different things and see what works for you, because for some women, some things work. For some women, other things work. So it's really important to try different things and see what works for you. So the number one tip that I tell moms for morning sickness is have a few crackers, like a little Ziploc bag of crackers, maybe some toast. But if you keep some crackers overnight on the nightstand next to your bed, before you even wake up, you have to wake up to eat crackers, but before you even put your feet on the floor, nibble on a few crackers, like saltine crackers, very bland, nothing fancy, and nibble on a few crackers. And what that does is that puts a little bit of food in your stomach, because typically what happens for moms is as soon as they wake up in the morning and their feet hit the floor, that is when that first wave of nausea hits you. So that's why you have a few crackers on your nightstand to see if that helps kind of control that first nausea in the morning. So that's the number one thing to talk about. The second thing is hot tea, and specifically ginger tea or a pregnancy related tea. And ginger has been a tried and true method for moms to help control nausea. And it helps even if you're not pregnant. So for example, I keep ginger chews in the car because I get really car sick. So even not being pregnant right now, I still have ginger chews at home. So when I say tea, sometimes moms can be concerned about that because sometimes, they tell you to watch out for teas because there are certain herbs that are not safe for pregnancy. And that is true. But if you find just a generic, like plain ginger tea or a pregnancy specific tea that is meant for pregnant women, then you're going to be okay. Something you can also do if you don't want to buy like tea from the store, you can always buy ginger root in the herb section, and you can just cut it up in slices, like peel it and cut it up in slices and boil that in hot water, and voila, you've made your own ginger tea. So there's a couple things you can do there. And a big thing to do, and I'll talk about this a little bit in the next slide, but make sure you don't gulp liquids. Like, do not just sit there and just gulp liquids. You want to take small sips because that's going to digest a little bit better than on your stomach. Another thing that helps moms is having a carbonated beverage. I particularly like carbonated water because it's not going to have all the added sugar of the soda. So having carbonated water, and because they are really popular these days, we have a bunch of different flavors of Nutritionist. So find a flavor you like. And having that carbonated water, what it actually does is it helps you burp. And being able to burp can sometimes relieve that pressure that you're feeling in your stomach. Like you have stomach ache, you just need to be able to burp, and after you burp, releases that pressure and you feel better. So for some moms, that helps. And again, that really helps me too when I get car sick. I always take something that's carbonated. Another thing that helps moms that are more nauseous throughout the day is focusing on having bland carbohydrates. So why is this? Well, it's easier for you to digest, and it doesn't put a lot of strain on your senses. So maybe having food that has a lot of sugar, or food that has a lot of spice, or food that has just a lot of flavor in general can kind of upset your stomach. So a lot of times moms find that plain toast with maybe some butter on it, some noodles, things like that, just plain carbohydrates, they tend to be able to tolerate that more. And this is really important because if you're nauseous all day, you need to be able to eat. You need to get those calories in to give your body energy, to give your baby nutrition, to give your baby energy, to give your baby those building blocks. So it's important when you're nauseous to try to get calories in and to eat when you feel like it. Even if you think it's not the healthiest thing to be eating toasted butter all day, if that's all that you can keep down, if that's all you can tolerate, by all means, eat the toasted butter. Like, have all you want. Because the important thing here is eating when you're able to and getting those calories in. The other thing that I mentioned, ginger chews for pregnancy specific, like nausea chews, have helped a lot. You can find those out online, but again, later this at the end of this training, I'm going to actually show you one of my new favorite companies and a pregnancy related morning sickness chew have, and that's part of the giveaway. So stay tuned for that. And another thing is having less stress and more sleep. So when you're stressed, when you're anxious, when you're tired, it can actually cause your nausea to be worse. And a good amount of sleep reduces your stress, which keeps your morning sickness. So being able to relax, being able to calm down a bit, whatever that may be, that's really important. Not rushing around so much. And one more thing, actually, two more things that I did not put on this list is sometimes smell, like cooking, can make moms nauseous. If that's the case, you might want to eat cold foods, cold sandwiches, things like that, cereals, peanut butter jellies, things that don't make us smell cooking, because that can set up a lot of stuff. And the last tip that tends to help a lot is make sure you always take your prenatal supplement with food. If you take your prenatal supplement on an empty stomach, it can make you nauseous. And if you're finding that it still makes you nauseous, even though you're taking food, if you're able to, if it's not like a gel, you can cut it in half, and you can take half at breakfast and half at dinner. Or you could take it right to bed, and sometimes you're able to sleep through that nausea. Those are a couple of tips and tricks you can do for helping. And there's a couple of things that you actually want to As I mentioned earlier, you want to avoid big gulps of food, or sorry, of drink. You want to make sure that you're taking sips, because the big gulps, having a large amount of liquid in your stomach can actually make it worse, especially if you're not eating anything. You might want to be able to avoid greasy or spicy food. The reason for that is sometimes that can be a trigger for moms. Sticking to those bland foods. You might want to avoid rushing. Give yourself some extra time to get ready. We want to keep ourselves from getting stressed, anxious, and overwhelmed. And then you want to avoid going long periods without food. If you go long periods without food, it can actually cause your blood sugar to drop, which actually makes the nausea worse. So keeping snacks nearby is really important. And it's important to have a few tables of food throughout the day anyway, even if you're not nauseous, because you don't want that drop in spike in blood sugar. And eat when you feel like it. Even if it's not the healthiest thing, it's still helping you get calories, which is giving energy and nourishing. So something that's really, really important is that you need to stay hydrated. Some moms will get hospitalized for dehydration because of nausea, because they can't keep it down. It's very, very important to stay hydrated. But that doesn't mean just drinking water throughout the day. There's different ways that you can get fluids. Water, of course, is great. You could also do carbonated water. You could do water with those little flavor packets in it. You can do tea. You can do milk. You can have juice. You can do popsicles. You can have soup, fruits. Like there's water in all sorts of things to get. And you might be dehydrated and not even know it. Now, we all know that being thirsty is a sign that we need to drink water, but it's actually a later sign of dehydration. So you can tell if you're dehydrated if you have dry mouth, if you have excessively dry throat, if you have excessively chapped lips and it's not winter time, if you have drier than skin, if your eyes seem sunken, if you're using the bathroom less often, if your urine is dark, and if you're feeling excessively exhausted, like more than usual pregnancy tired. Also, if you feel lightheaded or dizzy, and if you're constipated. So these are all signs that you might be dehydrated, and it's important to get extra food. And the reason for this is because dehydration can cause lots of unpleasant things in you and your baby. It can cause neural defects. It can cause having you to have low amniotic fluid, which can cause all sorts of things. It can cause premature labor. It can cause poor breast milk production, and in some severe cases, it can cause birth defects. So this is why it is super important for us to stay hydrated when pregnant. Now, when is it time to be concerned about your nausea? When is it excessive? So it's time to be concerned when you're losing more than 2 pounds. Sometimes women in the first trimester who are nauseous might lose a pound or 2 because of the nausea, because they're not getting all those calories they need. And that's okay. That's actually kind of normal. But if we are losing more than 2 pounds per week, or if we're losing weight excessively fast at one period of time, that's when we need to go to our doctor. If you have severe vomiting that will not stop, it's time to call the doctor. And if you ever have vomiting with blood or something that looks like coffee grounds in it, go to the hospital. So these are times when we are going to be concerned. But I don't want to scare you, because there's lots of things you can do to help with nausea. So now I want to talk a little bit about this new company that I have found, and it's called Pink Stork. And Pink Stork is a company that is owned by a mother of 5, and she has a mission to help women throughout their pregnancy journey, whether that be preconception, prenatal, breastfeeding, postpartum, and she even helps with men's fertility as well. So there's a couple different avenues that you can take. But of course, my two favorite products that they offer are the morning sickness sweets and the morning sickness tea. And I'm going to go ahead and stop screen sharing here so I can talk. But I had a representative who was nice enough. Her name is Taylor, and she has agreed to give our a special giveaway of the morning sickness tea and the morning sickness sweets. So what I did, I have the morning sickness tea here. So you can see it. Yeah. So I have the morning sickness tea here, and I went ahead and boiled me some water to show you guys kind of what it looks like and everything. But this is their morning sickness tea. And because it's pregnancy specific, you don't have to worry that they're not putting any harmful herbs in there that would be harmful to pregnancy. So I'm going to go ahead. I have my little cat mug, and I'm going to let this steep for a few minutes while I talk about the chews. So one thing about this tea, I think it smells like bubblegum. And I think I had one yesterday, and I think it tastes like bubblegum too. But the morning sickness tea has ginger in it and red rubius in it as well. It also has peach. And what was the other one in there? Peach and orange. So it's pretty fruity. But this one actually comes with 15 tea bags in it. But I'm gonna let that steep in a minute. And then the other one that they gave us as a giveaway is the morning sickness tea. So it's a raspberry ginger flavor. So you can see it. And there are 30 of them in here. And the instructions actually tell you to take one piece at a time and do it 1 to 4 times a day. So if you were to do this once or twice a day, you would have, if you did it once a day, it's a 30-day supply. If you did it twice a day, it's a 15-day supply. But it's a cute little pink lozenge, and I actually haven't tried this flavor yet, so we're gonna try it out. I think it tastes good. Again, I think it tastes like bubble gum. So the ingredients are organic sugar, organic brown rice syrup, organic ginger, and natural raspberry flavor. And I believe it also has B6 in it. I can't remember. Because B6 has been shown to help. B6 has been shown to help improve nausea as well. So I'm going to put that to the side for a moment. And we're going to try this tea. So again, I've only let it steep for about a minute. But this is what the tea bag looks like. It's got different herbs in it. And I think it tastes like bubblegum, but it's very refreshing. But these are the two products that Pink Stork is going to be offering a special giveaway on. So if you're watching this live, or if you're watching this as a replay, make sure to comment. What are we going to comment? Comment Pink Stork on the comments of this video, and I will make sure everybody gets entered into a raffle, and we'll have 2 winners, and one winner will win the morning sickness tea, and one winner will win the morning sickness lozenge, and then the representative from Pink Stork that is working with us will send it directly to your house, so you don't even have to worry about any of that. I will connect you to. You don't have to give me your address. You can give it to her, and she'll make sure you will get that. So again, I hope you all found really valuable information in tonight's training. I know nausea affects a bunch of women, and I really hope that you found value and maybe learned tips and tricks tonight and are able to check this company out. Of course, they were very kind to offer to do a giveaway, so I'm very thankful for that. So again, comment Pink Stork, and if you have any friends that you think would benefit from mom and baby nutrition support, feel free to invite them, send them my way. And if you're struggling with nausea, morning sickness, pregnancy-related issues, and you're looking for some higher level additional support, feel free to reach out to me on Messenger leave me a comment. Anyway, I'd be really happy to see kind of what support I'd be able to give you. If you're looking for next steps, the best thing we could do is hop on a quick call. I would not sell you anything on this call. Just a quick 10 to 15-minute call to kind of assess where you are in your pregnancy, what your goals are, and kind of how we can help get you to those goals. If that's something you're interested in, if you go to the cover photo of the group and you click on it, there will be a link to book a free call. Again, I'm not going to try to sell you anything in this call. It's just to kind of see where you are, what your goals are. And after that call, if together we decide that moving forward would be the best idea, then we could do that at that time. But mamas, I hope you have a wonderful, wonderful rest of your week, and I will see you on next Wednesday. Don't forget to comment, and I will remind everyone to comment again later this week as well. So you all have a wonderful rest of your day, and I'll see you next week. Bye.